The information in this episode is current as of the date recorded and is not intended as financial, tax, or legal advice. You should consult your tax, financial, and/or legal advisors before implementing any transactions and/or strategies concerning your finances.
For a lot of people, signing up for Medicare feels like crossing the ultimate finish line. There's this comfortable assumption that once you're enrolled, your healthcare-related financial risks are pretty much taken care of. But here's the reality. Medicare is a foundational layer of coverage, not a comprehensive solution. Without a clear understanding of its limits, medical expenses can become a silent drain on your portfolio, throwing a massive wrench into your long-term cash flow. Today, we're breaking down the major hidden gaps where Medicare ends and your personal assets have to take over, so you can build a truly resilient retirement budget. Let's start with what I call the big three. Original Medicare, that's parts A and B, generally excludes routine care for the three areas most likely to decline as we age: dental, vision, and hearing. Out-of-pocket costs for cleanings, crowns, glasses, and hearing aids can easily run thousands of dollars per year. To cover these gaps, you have to make a major structural choice, and this choice has long-term consequences. You essentially have two paths. Path 1 is Medicare Advantage, or Part C. These plans are popular because they offer low premiums and bundle those dental and vision extras. The catch? You have to use a restricted network of providers and often deal with prior authorizations for specialists. Path 2 is Original Medicare plus a Medigap policy. Medigap is private supplemental insurance designed to fill the gaps. It gives you the broadest provider access and highly predictable costs, but your monthly premiums will be higher. Here's the long-term risk most people miss. Switching from Original Medicare to Advantage later in life is easy. Going the other way, however, is not. After an initial 12-month trial period, switching back to Original Medicare usually requires medical underwriting to secure a Medigap policy. If you've developed a chronic condition, insurers can deny you coverage or charge you prohibitive rates, effectively locking you into an Advantage plan's network. Next up is perhaps the single biggest financial blind spot in retirement planning: long-term care. A lot of retirees assume Medicare will cover a nursing home or assisted living if they need it. It won't. Medicare is strictly designed for medical treatment, not residential support. It only covers skilled nursing for a very limited window, up to 100 days, and that's only after a qualifying hospital stay. It does not cover what's called custodial care, which is basic assistance with daily activities like bathing, dressing, or eating. This kind of care can span years, and without dedicated planning, it can lead to an accelerated asset depletion that your initial retirement models never anticipated. Even if you have Part D coverage for prescription drugs, your medication expenses remain a highly variable cost. Every single year, private insurers adjust their formularies, the lists that categorize which drugs are covered and at what price tier. A medication that is perfectly affordable this year could be reclassified into a much more expensive tier next year. And if you're a high-earning retiree, you have another hurdle to clear: IRMAA, or IRMAA, the Income-Related Monthly Adjustment Amount. These are mandatory surcharges added to your Part B and Part D premiums, and they're based on your modified adjusted gross income from 2 years prior. Effective retirement planning means coordinating your tax efficiency today to avoid unexpected spikes in these fixed costs tomorrow. Finally, for those planning to enjoy their retirement traveling the world, keep this in mind. Original Medicare provides virtually zero coverage outside the United States. A medical emergency abroad can result in massive out-of-pocket bills and medical evacuation costs that the federal program simply won't reimburse. If you're a frequent traveler, you need a strategy. Check if your supplemental Medigap policy includes a foreign travel emergency benefit, or make it a habit to factor standalone travel medical insurance right into your annual vacation budget. The bottom line is that healthcare shouldn't be treated as a series of random, surprising expenses. It needs to be treated as a recurring, predictable part of your retirement budget. When you move from a reactive stance to a proactive financial modeling, you protect your withdrawal strategy, your lifestyle goals, and your legacy. Identifying these gaps today is the absolute best way to ensure confidence and stability for tomorrow.
Thanks for watching. If you found this video helpful, give it a thumbs up and hit that subscribe button so you don't miss future updates. Looking for more insights like this? Head over to our website at jgua.com for additional resources. And if you'd like to talk about your personal financial goals, we'd love to help. Just click the Schedule a Meeting button highlighted on your screen to book your complimentary consultation. Thanks again for joining us. We'll see you in the next video.